If you are studying for boards, you know that B12 deficiency is a favorite topic. But it's not just about anemia. The neurologic complication, subacute combined cord degeneration, is a classic board question. The name isn't just descriptive, it's a clue. Condition that developed over weeks to months, and affects multiple specific tracts in the spinal cord, plus causing irreversible damage if you miss it. But for the exam, you need to know the mechanism. Why does a missing vitamin cause the spinal cord to fall apart? Let's walk through the biochemistry and anatomy. That will show up on your test, plus causing irreversible damage if you miss it. Clinically, this is a demyelinating disease. But unlike autoimmune multiple sclerosis, this is metabolic. B12 is a cofactor for exactly two enzymes in the human body. In subacute combined degeneration, both pathways go wrong, creating a two-hit attack on the myelin. So, B12 deficiency causes a maintenance failure along with toxic buildup of material, damaging myelin sheath. B12 is a required cofactor for the enzyme methionine synthase. This enzyme converts homocysteine into methionine. Without B12, body build up homocysteine, but more importantly, it run out of methionine. Methionine is converted into S-adenosylmethionine, or SAM. SAM is the body's universal methyl donor. It donates methyl groups to myelin basic protein to keep the insulation stable. No B12 means no SAM, and no methylation. The myelin falls apart from lack of maintenance. B12 is also a cofactor for methylmalonyl county A mutase. This enzyme converts methylmalonyl county A into succinyl county A. Without B12, methylmalonic acid builds up, but the damage comes from what happens next. That excess is used to synthesize abnormal odd-chain fatty acids. The body tries to use these abnormal fatty acids to build myelin, but they are structurally unstable. The myelin sheath becomes fragile and prone to collapse. Why does this demyelination cause a combined picture? Because it picks two specific neighborhoods in the spinal cord. First, the posterior or dorsal columns. These carry vibration and proprioception up to the brain. This is why the first sign on physical exam is loss of vibration sense in the toes. Second is the lateral corticospinal tracts. These carry motor commands down from the brain. This is your upper motor neuron pathway. Damage here causes weakness, hyperreflexia, and an extensor plantar response. This creates a mixed picture, with lower motor neuron signs from peripheral neuropathy, hyperreflexia early on, but upper motor neuron signs in the legs, spasticity and Babinski. This combination is a huge red flag for subacute degeneration. Now it's time to revise the concept by solving typical board-style question. A 55-year-old vegan presents with gradually progressive tingling in his hands and feet, and difficulty walking in the dark. On exam, he has loss of vibration sense at the ankles, a positive Romberg sign, and upgoing plantar responses. This is subacute combined cord degeneration. If the question asks for the lab finding, they won't just say, low B12. They'll expect you to know the specific metabolites. Elevated homocysteine from pathway 1 failure, elevated methylmalonic acid from pathway 2 failure, or hypersegmented neutrophils, the most sensitive hematologic finding. For your exam, remember the 2 of subacute combined cord degeneration, 2 pathways, and 2 tracts.